that mean it's going to work in an hour, 2 hours, 30 minutes, 15 minutes? And I can read pretty good.
It probably depend on your body.
So I don't know how much of this should I take?
None.
Why?
She said no, but I hurt. My back hurt. My knee hurts. My shoulders. My workout was killing me.
You got so many milligrams.
And 500 sounds like a lot, right?
Yeah.
Well, here's the trick. Acetaminophen, you can get 250, you can get 500, you can get 650. 500 is the middle of the road. But FYI, for acetaminophen, 4 to 6 hours.
800.
Okay? Why do they give you a range, 4 to 6? Sometimes, some people after 4 hours, the relief goes away and it's not helping them. This range allows you to take another one after 4 hours. Not after 1 hour, not after 2 hours. You must wait 4 hours or 6 hours. Now, they didn't tell me how many, okay? There's a saying in medicine when I was in training, start low, go slow, okay? I'm in severe pain, my pain is 10, let me take 10 of them. No, start with 1. Now, there's a thing called a half-life. And this is the most important thing to know about medicine, but they really don't tell you this. Pharmacists knows and doctors knows. The half-life is how long before half of this is gone. Okay? So this is how medications work. You take the medicine right here. In this case, this medicine may not start working for about, and I know from experience, for me, acetaminophen, Tylenol, takes 1 hour at least. So this is what happens. Okay? So halfway point, it's high, but half of the medicine's gone, and then it's completely gone in 4 to 6 hours, right? So in this case, if you take this medicine at 9 o'clock in the morning, don't go take another tablet at 10 o'clock. You have to wait 4 hours. But what you learn, if you don't feel anything after 1 hour, what did you learn? It don't work, throw it away. No. You need more. You can take 2, right? Unless, of course, you have liver disease or you have anything, other medication that contains Tylenol in it. But starting low, go slow. 1 did not give me any relief. What does relief mean? When I started, my pain was 10. After 1 hour, it was 9. That's not helping, okay? Relief is going down to like 7 or 6. So that tells me I may need to take 2, okay? And why is there such a range? Because we're individuals, we're different. Your mother may take 1, but your cousin may take 2. Another person can't take it at all because they have liver disease. So don't just go by what other people do. You have to learn your body, which I always tell you, know your body, right? Okay. But I have concerns about this one because this didn't have any instructions. And this is over the counter. And what I mean by instructions, how often, how many? So when your doctors tell you, oh, you can take this as needed, how much, how often? Right? Those are the 2 questions. Yes.
Those things don't have serving size. It doesn't tell you like how much.
Sometimes they do. This one in particular has no serving size. And serving size is usually when we're talking about like foods and natural things. Like I was asking about vinegar, right? So someone says, have a teaspoon of vinegar, or better yet, a lot of people are using turmeric, right? Turmeric as an anti-inflammatory, helps reduce inflammation. Have you ever seen a turmeric? Have you ever actually seen one? It looks like ginger, right? Okay, so how much of that ginger looking thing are you supposed to take? Do you eat the whole thing? Do you take piece of it? And what do you do with it? As much as you want, right? No, because it's natural. You can have as much as you can have whatever you like. You can invest. No, yes.
Don't like the herbalist type of, those doctor people that specialize in that. Don't they have the amount you're supposed to take and all that?
So, good question. Do I need to go see a specialist like I do my primary care doctor who specializes in herbal medicines? Well, you can. That is an option for you because that's exactly what they do. They specialize. But turmeric and many of these things like onion and garlic and vinegar is very person dependent, right? So the recommendation like turmeric, after it comes in the look like a ginger thing, you can cut it into pieces, you can boil it down, you can drink it as a tea, you can get it in the powdered form, and oftentimes when it's in the powdered form, it's concentrated, and some would recommend just taking 1 teaspoon, putting it in water, and drinking that, or putting it in your smoothie. But again, it's dependent on you as an individual. You might take 1 teaspoon and you're like, this ain't doing nothing for me. And you may need 2 teaspoons. And again, the source, is it really turmeric or is it ginger? Is it really what it says it actually is? How do you know? Well, I need everybody to start reading. You have to educate yourself on what you're putting inside your body, right? Like I brought this one here. Anyone ever seen? I can't show the labels unless they sponsor me. But anyway, this one is meant to soften your stool. Anybody ever was told by the doctor, oh, just get some over-the-counter stool softener? You been told that?
Yeah.
Because you're constipated, having trouble going out. How much? Which one? You ever walk in the store and you're like, they got Colace, they got Metamucil, they got Miralax, they got the orange bottle that look like Sprite and ginger ale. Then the blue one, the milk and magnesia.
Castor oil.
Castor oil. Which one and how much? Right? So in this case, they've made it into a packet so that one of these happens to be a dose. That means this is all you're going to take. So then the question is, okay, that's how much. So you're going to take the whole thing. And it says, this is the got you. How to use. Relieves occasional constipation. What if you're constipated every day? That's not occasional. So then the recommendation would be every day. Now, can you take it every day?
No.
That's a question for your provider. That's the person you ask your doctor, but actually in this one you can. But let me go on. It says generally, I love these words, generally produces a bowel movement in 1 to 3 days. Okay, now let's talk about this. I'm constipated. That means I haven't gone in 1 to 3 days, or 4 or 5, or a week or 2. Then I'm going to take this and can't turn it. And then it says 1 to 3 days. What are your thoughts?
If it take that long, it don't work.
Maybe. Good question.
Or they just want you to keep buying it.
Or they want you to keep buying it. So the question is, back to knowing yourself, right? Some people take one of these babies and in 4 hours, it works. Some people take one and it's 2 days, right? So you have to know yourself, but you start low, slow. Take one, drink it. Tomorrow you don't have bowel movement, take another one, and the next day. Yes, you can take this every day. Yes, good question.
Would how long it take depend on how backed up you are?
Good question. Now, constipation is a whole other subject, but I'm going to give it to you in a nutshell. Constipation can be caused by, number one, diet, right? Are you drinking enough water? You must hydrate. Your intestines is a highway, okay? And it gets into a traffic jam if there's not enough fluid to move things along. If you do not have a bowel movement, excess waste in your body, that's why you have bowel movement, it's waste, sits. When anything sits, the fluid is taken out of it, and then it hardens. And the longer it sits, the more it hardens. So it makes it harder and harder to move through the tunnel of your intestines, right?
Right.
So the question is, do you need more to get bowel relief if you've been constipated for a very long time? Maybe. One of the things I recommend, if you haven't gone in a very long time, since we're talking about constipation, it's piping. Throwing something on top when the bottom is clogged is not going to help. Okay? You have to do two, top and bottom cleaning, right? And often these are the times when you need to fast from adding any more to the system. Your system is clogged. It's like you have clogged pipe in your house and you keep turning on the water and put things in the drain. What's eventually going to happen?
Bust. Big problem.
Start coming back up. Start coming back up. So that's where you take the Roto-Rooter, a stool softener, a laxative, and a Fleet enema. Fleet is the name brand. You can take generic, taking out the bottom or taking out the top. Emergencies. I have to say this since I'm a physician speaking. It's an emergency if you start bloating, your stomach starts getting hard, and you start feeling nauseous. You may have a condition called a bowel obstruction. Nothing's moving, and it can rupture and cause all that, what I call waste, to get into your intestine. So please try not to let a couple days go by and don't have bowel movement. So one, your nutrition, fluid, yes?
For years and years, I don't have bowel movement, and doctors are surprised. You don't have one every day? No. Does it bother you? No. Why is it such a surprise?
Why is it? So the question is, well, for years I've been like this. I haven't had bowel movements, and it hasn't bothered me. I'm not nauseous. My abdomen doesn't get swollen. I'm not bloated. My stomach doesn't hurt. That's your norm. And that's where you know who you are. But for the most part, many people who don't have bowel movements regularly, they get gassy, they get bloated, they feel nauseous, they feel weak and tired, right? So when you start feeling like that, you definitely. So fluid makes a difference. What you eat makes a difference. Fiber. You must have high fiber, and it comes in the form of natural fruits and vegetables. Not drinking them. Drinking orange juice, drinking apple juice is not adding fiber to your system. You literally have to eat it and eat the skin. In the oranges, you have to eat the entire fruit. Don't just squeeze it. That adds fiber. Followed with lots of water helps it to move. Third things that causes constipation is medications. Many